When administering medication via gastric tube, it's very similar to administering medication to a patient as far as gathering your equipment, doing the 3 checks, knowing the nursing action, special consideration, safe dose range, purpose for the medication, any adverse effects. You need to also consider the appropriateness for the medication for the patient. It's going to be a little bit difficult demonstrating this at home, especially with my helper here that I have. But I'm going to do the best that I can explaining all this and going over it. So I'm going to perform my hand hygiene, make sure I have my medications gathered. I've already done my 2 checks while I'm gathering all this medications, and I'm getting everything together. Now we'll pretend like I have a pill and a liquid just to make sure I hit both of those topics. So if I have a pill, I'm going to use a pill crusher, and I want to make sure I crush each pill one at a time and dissolve the powder with water or other recommended liquid in a liquid medication cup, and then keeping each medication separate from the others. And then I need to keep the package with the medication that it belongs with for future comparison for the information, and just in case the patient might have any additional information. If it's a liquid, I need to pour this liquid with the liquid. Let's pretend that this is the liquid, so the label needs to be against my palm. When pouring it, I need to make sure that I clean the lip of the bottle. When pouring it, if it's a multi-dose container, I need to make sure that it's labeled appropriately. I need to check the expiration dates. I need to do all that like I would when administering any other liquid medication. I need to make sure that I'm using the correct measuring devices. I pour the correct amount of liquid medication into the correct device, and then whenever I'm ready to take all these medications to the patient and put everything back up according to facility policy, whether it be in the MAR or the PICSI or in the patient, if it's in a special patient container, if it's a multi-dose vial, it might be kept in the patient's drawer, wherever it may be, and clean up my area. Then I'm ready to take everything to the patient. When I get to the patient, I can do my 3rd check, and that's going to be either to scan his or her wristband, or sometimes it's scan the wristband and ask, his or her name. I just need those 2 patient identifiers to verify the patient. Make sure the patient's sitting in high Fowler's position unless contraindicated, and make sure that I do hand hygiene, close the patient's curtain, put on some gloves, and make sure that if the patient has continuous feeding, that I stop that, because I don't want to make a mess with the continuous feeding where I'm going to be administering the medication, because the continuous feeding will just keep going. Also, I'm going to have to irrigate the tube with water before starting, because before you do anything to the NG tube, how I like to remember it is you always have to flush it with water. It's just like an IV, you have to flush it. So before giving medicine, you flush. Before giving food, you flush. So always have to flush. It's the way I like to remember that. So before I do anything, it's going to be a little bit hard to, or pretend, but here, we'll take this. We'll pretend like this is attached, and this is attached to here. So what I would do is I would just dump some water in here and make sure it all goes in. And I've already made sure the NG tube was in place. With my last video, the placement was fine, and we were in the room at the same time, and so I had just checked that and then went to get the medication. So the NG tube and everything has already been checked that it's in the correct placement, and everything's been good there. So placement's already good, because you do want to check that the NG tube is in the right place before you administer any medication or food or anything. But since it is in the right place, I'll go ahead and I've already checked the content in the stomach and everything, so I went ahead and flushed it with some water. And then go ahead and I'll put in the liquid first. So you flush with a little bit of water, and then you put in the liquid. And then once the liquid's in there, you have to let all of it go in. And then you put some more water to make sure all the liquid is cleared out of that syringe and then out of that NG tube. You just want to make sure all of it goes in. And then you're going to do the same with the pill. You put in that medication, and then it goes all the way through. And each time you flush it with water, you want to make sure that you are following with 5 to 10 mLs of water flush between each medication dose, and then follow the last dose of medication with 30 to 60 mLs of water to flush it out. And then once you're done, you're going to secure that clamp back. or remove the clamp, secure everything back there, make sure everything's in place, make sure that it's back where it needs to be, do some checks, and then remove your gloves and your PPE, do some hand hygiene, document, make sure the patient is comfortable, and get everything good to go. And then you can elevate the head of the bed and remain elevated to at least 30 degrees, because where the patient just had medication, they just need to be elevated for a little bit to at least 30 degrees.